Hi, I'm Dr. Mark Faber, and I practice child, adolescent, and adult psychiatry in Upper Montclair, New Jersey. And this topic is a review of cognitive behavioral therapy strategies for anxiety and depression. And it's very important to know some of the terms used and understand how they're used, and then I will give specific examples. So when we think of anxiety, for example, and we want to address this in a non-medical approach, we use CBT, or cognitive behavioral therapy. One approach is to use gradual exposure and desensitization. This is where the feared situation is one that we encourage gradual exposure to, and then over time the person becomes desensitized to the feared situation. The second area has to do with cognitive restructuring. Now, cognitive restructuring is where we take thoughts or worries and we identify those worries and challenge them. In depression, we're identifying negative thoughts and learning to challenge those. So cognitive restructuring, exposure, and desensitization are key approaches. Now, examples. If we're talking about panic disorder, and let's say a person is very fearful in a certain crowded situation or crowded place, then we might have them start out with a one-to-one or small group interaction, and then build that into situations where it's more crowded, like a mall or shopping center, for example. When we do exposure and desensitization, it's done first through imagery, where we imagine doing the things we fear doing, and then we gradually do them in real life. So we might even set up what we call a triangle or hierarchy of exposure and work our way from the easier things that we can do to the more difficult things. Now, this also applies, for example, in social anxiety. So maybe talking with a friend in a familiar situation and moving forward to unfamiliar interactions with people you haven't met and in larger group settings. So that again is exposure and desensitization. The more you do it, the less you will respond with anxiety. In OCD, or obsessive compulsive disorder, we modify this using what we call exposure response prevention. So if the worry is about germs or dirt, exposure to something that might make hands dirty, but then preventing the response, which is the need to hand wash or use something on the hands to keep them clean. And we do this over progressively longer periods of time. So these are situations where in anxiety, we label the thoughts, the anxiety or the worry. We challenge the thought, that's the cognitive restructuring. We expose ourselves to the situation and desensitize. The third component, key component, is relaxation. And for relaxation, it's practicing what we call diaphragmatic breathing. So breathing in through the nose, holding it for 3 long seconds, and then blowing out from the mouth as if you're blowing out a candle. And we usually recommend doing this in groups of 3. So ideally, using relaxation is done when a person is not anxious at all. They practice it. And then they begin to combine the relaxation with the exposure to situations through imagined situations. And then they combine the breathing as well as the cognitive restructuring with situations that are real life situations. In depression, as opposed to worries, we're thinking about negative thoughts. And so the key is to step back, identify and label the negative thought, and then learn to correct or challenge it. So cognitive restructuring is used in depression as well. This then is an overview in regard to cognitive behavioral therapy for anxiety and depression. Thank you.